Hello students, in today's video I will discuss about the pharyngeal arches. So let's discuss MCQs on this one by one. The pharyngeal clefts are lined by. Now you know that whenever we are talking about the pharyngeal arches, the outer area which is showing the invagination is known as cleft, and these areas are outer side lined by which layer? Ectoderm, endoderm, mesoderm, neural crest cell. So dear students, answer C, the clefts are lined by ectoderm. Next question, the pharyngeal pouches are derived from. So what is the pouch? Now when you will see this arch, now in the arch you know that the outer is known as cleft, the inner depression is known as pouch, and inside you will have the endoderm. So answer B. Next question, Meckel's cartilage is associated with. Now this Meckel's cartilage is the cartilage of first pharyngeal arch. So what is the answer? Answer C. Next question, which ear ossicle develops from Meckel's cartilage? So dear students, you have to remember that M for Meckel's, M for malleus, and apart from that it also gives rise to the incus also. So answer B, the Meckel's cartilage give rise to the malleus. Next question, Reichert's cartilage give rise to incus, thyroid, stapes, cricoid. So dear students, the Reichert's is a cartilage of second arch, and all the things which are starting from S, answer is stapes. C, which is a cartilage of Reichert's cartilage is a cartilage of second arch, and it give rise to the stapes. Next question, the greater cornea of hyoid bone develops from first arch, second arch, third arch, fourth arch. Now when you will have the hyoid bone, you know that this is the shape of hyoid bone. Now this is the greater cornea, this is the lesser cornea, and if you will divide this into the two part, you know that this lower half of the body and greater cornea develops from the third arch, while the lesser cornea and the upper half of body develops from second arch. So this is greater cornea, so answer is C. Next question, cartilages of larynx are mainly derived from first arch, second arch, third arch, fourth and sixth arch. So dear students, first arch will give rise to the cartilages develops from the Meckel's cartilage, second arch give rise to the cartilages develops from the Reichert's cartilage, fourth and sixth arch are give rise to the cartilages of larynx. Answer D. Now next question, epiglottic cartilage develops from Meckel's, hypobranchial eminence, Reichert's, third pouch. Answer B. The epiglottis develops from hypobranchial eminence. Next question, which muscle is not derived from first arch? So what are the options? Tensor tympani, mylohyoid, stapedius, tensor veli palatini. Now here you have to keep this thing in mind. Stapedius supplied by facial nerve. Facial nerve is a nerve of second arch, and we are dealing with the first arch. So answer C, it is not derived from the first arch. Remaining three supplied by the branches of mandibular nerve derived from first arch. Muscle of facial expression develops from. Now again the muscles of facial expression motor supply comes from facial nerve, and facial nerve is a nerve of second arch. So facial muscles develop from second arch. Second question, stylopharyngeus muscle develops from. Now this is the only muscle, or you have this question so many times, that there is only one muscle which develops from the third arch and supplied by glossopharyngeal nerve is stylopharyngeus. Next question, nerve of first pharyngeal arch. So I just told you the first pharyngeal arch mainly is having a nerve is mandibular nerve. Next question, the chorda tympanic nerve. Next question, ductus arteriosus develops from first arch artery, third arch artery, fourth arch arteries, left, sixth arch artery. Answer D, the ductus arteriosus derived from the left sixth arch artery. Next question, the cervical sinus is formed due to overgrowth of. Now when you will have the arches, now these are the arches. Now when you will have the second arch, now this second arch will show the overgrowth and it will extend downwards, and this space deep to the second arch is known as cervical sinus. So it develops because of the overgrowth of second arch. Branchial cyst is usually located along posterior border of sternocleidomastoid, midline of neck, anterior border of sternocleidomastoid, supraesternal notch. So dear students, it is along the anterior border of sternocleidomastoid, and this branchial cyst is there because of the persistence of cervical sinus. Next question, a young adult presents with painless cystic swelling along with anterior border of sternocleidomastoid. The lesion is diagnosed as a branchial cyst. So there are two important key features, along the anterior border and it is a branchial cyst. This most likely due to persistence of which pharyngeal arch structure? First cleft, second cleft, third pouch, second pouch. So dear students, when there is a formation of the second arch, it will persist downward as a cervical sinus, and sometimes its cleft will persist as a branchial cyst. Next question, DiGeorge syndrome is caused by? So dear student, it is a kind of chromosomal abnormality, occurs because of the 22q11 deletion. So it is a direct knowledge based question, answer B. Next question, auditory tube develops from first pharyngeal pouch, second pharyngeal pouch, third pharyngeal pouch, fourth pharyngeal pouch. Answer A, develops from first pharyngeal pouch. Next question, palatine tonsil develops from? So dear students, the palatine tonsil develops from second pharyngeal pouch. Answer B. Now we'll move to the next question. Inferior parathyroid gland develops from? So you know that there is a inferior, there are 1 and 2. There are two parathyroid, one is known as superior, another is known as inferior. But embryologically this inferior is developing from above and later on it will descend downward. So it develops from the third pharyngeal pouch along with the thymus gland. Next question, parafollicular cells of thyroid develops from? So answer is ultimobranchial body. Answer C. Now I'll move to the next question. The first endocrine gland to develop in embryo is pituitary, adrenal, thyroid, thymus. Answer C, thyroid gland. So by this we finish today's session. In this I will try to discuss some very commonly asked questions from the pharyngeal arches. I hope these questions will definitely help you in your revision. Thank you and bye bye.